The burden of disease is the gap between a population's current health status and its best possible health, where everyone can live as many healthy years as possible. Environmental stressors, such as air pollution and environmental noise, can increase the burden of disease, for instance by exacerbating and increasing the risk of chronic diseases and mortality. We can measure the impact of environmental stressors through the environmental burden of disease. This approach enables us to estimate how much of the total disease burden in a population is caused by exposure to an environmental risk factor. Comparing different input data can also help us to better understand the resulting attributable burden estimates for quantifying health impacts, based on the exposure level of the population, the links between exposure and health outcomes, known as exposure response functions, a baseline or counterfactual level of exposure, and the number of years of healthy life lost due to specific diseases, measured in specific disability-adjusted life years. By quantifying and comparing the influence of different risk factors, we gain a clearer picture of the most serious health threats posed by environmental exposures. The EU-funded Best Cost project uses 5 case studies to improve how we estimate the disease burden and socioeconomic costs of environmental stressors. Best Cost can support better policy decisions at both the European and national level by evaluating the impact of interventions on the burden of disease from environmental stressors and help people live healthier lives. To find out more, visit best-cost.eu.